This video is about our PHD311 video assignment. In this slide, we provide our group members. We are from Hospital Chancellor Tuanku Mukris, SCTM.
Baik, stigma masyarakat terhadap pesakit AIDS menjadi antara faktor utama yang membantutkan usaha Malaysia menghapuskan virus HIV menjelang tahun 2030. Ia menyebabkan pesakit malu untuk tampil mendapatkan rawatan, akhirnya mendedahkan risiko penularan virus kepada orang lain.
Terdapat trend peningkatan yang membimbangkan kes jangkitan HIV dan pelajar-pelajar tinggi IPT berumur 18 hingga 25 tahun di Malaysia.
Data itu dikeluarkan secara bertulis oleh Menteri Pengajian Tinggi Datuk Seri Dr. Zamri Abdul Kadir bagi menjawab soalan lisan yang dikemukakan Ahli Parlimen PN pada AZRAI.
The case study that was given to us is a 30-year-old HIV positive man presented for a follow-up visit. His CD4 plus lymphocyte count was 350 cells per millimeter cube. A normal CD4 plus lymphocyte count was supposed to be more than 500 cells per millimeter cube. A highly active antiretroviral therapy HAART was initiated by the doctor. Before we jump right into the explanation for what is HAART, we need to know more about the disease first. So, let's begin with what is HIV. HIV, or more known as human immunodeficiency virus, is a virus that damages our immune system cells by specifically targeting CD4 cells. These CD4 cells are very crucial for fighting infections in our body, whereby this virus will then impair our body capacity to fight against common diseases and infections. HIV can be found in the body fluids of an infected person. This includes in semen, vaginal and anal fluids, blood, and also breast milk. Because of its fragility, the virus does not last long outside of our body. Have you ever wondered how HIV spreads and why we need to understand the ways it is transmitted is so important for protecting ourselves, supporting others, and working together to prevent the spread of this virus? So, in this video, I will explain 3 common ways on how HIV virus is transmitted between an individuals. First, by sexual transmission. It is from unprotected sexual activity through vaginal, anal, or oral sex with someone who has HIV. The second one is HIV can be spread through blood contact when sharing needles or syringes because contaminated blood can transfer the virus directly into another person's bloodstream. The last one is HIV also can be transmitted from mother to child transmission. This is because HIV can pass to a baby during pregnancy, childbirth, and breast or chest feeding. This is called perinatal transmission. Recognizing the symptoms of HIV is essential for early detection and timely treatment. But do you know what signs we need to look out for? So, in these slides, we are going to explain more about symptoms of HIV and how can you tell if you have HIV. First, the most common symptoms are raised temperature, or more known as fever, sore throat, body rash, and headache. Next, the infection progressively weakens the immune system. This can cause other signs and symptoms that are more severe, such as swollen lymph nodes, weight loss, diarrhea, and night sweats. If you are having any of these symptoms, make sure you go to nearest clinic and get yourself checked. The treatment of HIV has been revolutionized by the development of HAART, a powerful approach that helps control the virus, boosts the immune system, and enables people to live longer, healthy lives. But what does HAART really mean, and how does it make such a difference? In these slides, we are going to go through an overview of what is HAART actually is. HAART stands for Highly Active Antiretroviral Therapy, was introduced in 1996, marking a major turning point in the treatment of HIV or AIDS. HAART uses 3 or more antiretroviral medications from various classes to suppress the virus, minimize drug resistance, and enhance the immune system. Why does HAART use many different classes of drug? This is because if one drug is unable to suppress a certain viral type, the others usually can. The primary indication for this combination medicine is to treat those who have infected with human immunodeficiency virus type 1, or more known as HIV-1. HAART used to be associated with triple drug therapy, but due to advancement in pharmacokinetics of drug nowadays, certain antiretroviral treatments now only require 2 different drugs only. Moving on to the next slide, HAART relies on a combination of antiretroviral medications to effectively manage HIV, and these medications are grouped into 6 distinct classes, which each of them playing a unique role in controlling the virus, blocking specific stages of virus life cycles, and protecting the immune system. So, the 6 classes of drugs used in highly active antiretroviral therapy to treat HIV are: first, nucleoside reverse transcriptase inhibitors; second, non-nucleoside reverse transcriptase inhibitors; third, protease inhibitors; fourth, fusion inhibitors; fifth, integrase strand transfer inhibitors; and last but not least, entry inhibitors, which include fusion inhibitors and CCR5 antagonists. Selecting the best drug from HAART medication for an HIV patient requires a thorough assessment of factors. The doctors in charge need to take into consideration of the patient's viral load, resistance patterns, comorbidities, and adherence potential. Therefore, the introduction of HAART has transformed the HIV from a fatal disease into a manageable chronic condition, which then improving the life expectancy of the patient, reducing transmission, and enhancing the quality of life for those living with the virus.
The main goals of HAART. So, what are the main goals of HAART for? To maximal and durable virus suppression, in my slide I provide the main objective: to reduce the plasma HIV RNA levels to the undetectable levels. The effect, this suppression help prevent the progression of HIV to acute immunodeficiency syndrome AIDS and reduce the risk of HIV transmission to others. For the next slide, I provide the factors that needed to be considered before initiating HAART. This slide, I provide 3 factors. For the first factor, baseline CD4 count and viral load. It is important to measure the viral load since elevated levels may be associated with a high chance of treatment failure. This baseline CD4 count is important to know whether a patient needs to start HAART. For the second factor is presence of comorbid conditions. This condition can affect the choice of antiretroviral regimen due to the potential drug interaction and the overall health status of the patient. Patients with HIV often have comorbid conditions such as cardiovascular disease, hepatitis B or C, renal dysfunction, and mental health issues. For the third factor, which is the last factor in this slide, risk of immune reconstitution inflammatory syndrome (IRIS), a condition where the immune system responds excessively to the previously underdiagnosed opportunistic infections after starting HAART. So, who basically can get this syndrome? The factor is the young age and also people who have very low baseline CD4 percentage. So, patients with advanced immunodeficiency may require close monitor after starting treatment to manage the risk effectively.
Now, let's learn about what are the examples of triple drug regimen by using a highly active antiretroviral therapy. The first examples are tenofovir plus anthracycline plus efavirenz, where tenofovir plus anthracycline is from a drug classes of nucleoside reverse transcriptase inhibitors, or also known as NRTIs, while efavirenz is a non-nucleoside reverse transcriptase inhibitors, or also known as NNRTIs. For the mechanism of action, tenofovir plus anthracycline, which is NRTIs, these 2 drugs are used by retroviruses to replicate the viral DNA. Then, when the drugs are incorporated into viral DNA, the change of viral DNA becomes faulty and viral replication cannot proceed. Basically, these nucleoside reverse transcriptase inhibitors will compete with natural nucleosides for incorporation into viral DNA. And then, for the efavirenz, this drug will bind to HIV reverse transcriptase enzyme, which induce conformational changes that cause enzyme inhibition, thus prevent HIV from replicating and controlling HIV infections. This is for NNRTIs. So as you guys can see in the picture of medicines in the center, this drug regimen is being combined in one film-coated tablets. For the second triple drug regimen, we have abacavir plus lamivudine plus dolutegravir, where abacavir and lamivudine is a nucleoside reverse transcriptase inhibitors, while dolutegravir is an integrase strand transfer inhibitors. For the mechanism of action, abacavir plus lamivudine, which is a nucleoside reverse transcriptase inhibitors. So these NRTIs will compete with natural nucleoside for incorporation into viral DNA, which means they will prevent the HIV virus from replicating. While for dolutegravir, which is an integrase strand transfer inhibitors, so it will prevent the DNA strand transfer by blocking the action of the HIV enzyme integrase, which then inhibit the insertion of pro-viral DNA into the host cell genome. Basically, dolutegravir will stop the virus from multiplying. Overall, abacavir and lamivudine will target the reverse transcription phase by preventing the conversion of viral RNA into DNA, while dolutegravir will act on the integration phase by preventing the viral DNA from becoming part of the host genome. For the last drug regimen, we have zidovudine plus lamivudine plus lopinavir, where zidovudine plus lamivudine is an NRTIs, while lopinavir is a protease inhibitors, which needs a boosting agent, for example, ritonavir. Why? Because most protease inhibitors require a boosting agent to increase drug levels in the blood and enhance efficacy of the regimen. For the mechanism of action, zidovudine plus lamivudine, which is a nucleoside reverse transcriptase inhibitors, will act on the reverse transcription phase, which preventing the formation of viral DNA from RNA. While for lopinavir, which is a protease inhibitors, will inhibit the HIV protease enzymes, which prevent the maturation of HIV, which leading to the production of immature non-infectious viruses. While with the use of a ritonavir boosting agent, this ritonavir will prevent the formation of infectious viral particles, complementing the action of NRTIs. So that's all from us. Thank you for watching.